Good morning, Bev. How are you?
I'm good, thank you, and good morning to you.
Thank you. I'm so glad you could join us today.
Well, thank you so much for having me.
You bet. I want to go ahead and give you a minute to tell us a little bit about your business and what
Okay.
also tell us some things that you do for fun.
Okay. Well, my business is called Living with Balance, and it's essentially about how to create balance in the busy lives that we all have. Most of us would love to have a lifestyle conducive to wellness and bringing joy into our lives. And this can include a lot of different things, such as easing stress and tension in the moment, developing simple, nourishing self-care routines, and just creating more balance in day-to-day life. Also developing a routine for getting a good night's sleep. Sleep is so important. Uh,
Right.
it just affects us on so many different levels. And then another big thing is, and this would be part of self-care, is being able to set boundaries and knowing how to say no with confidence. So all things that can help us in our busy lives. We all have very busy lives, and just some coping strategies to make things easier.
Very good. Very good. So what do you like to do for fun?
For fun. You know what? I love yoga. I'm actually a certified yoga teacher. I haven't taught in a while, but I still really enjoy that. In the area I live in, we have a lot of ravines, and there's nothing I love more than just hopping on a ravine trail and hiking. And I like to go with friends. It's always more fun with friends, although I'm
Yeah.
happy to go on my own too if nobody's available. Um, I like traveling. Traveling is fun. It doesn't have to be international. I can travel within the country or, North America in general. Just got back from Tulum, Mexico a few weeks ago. So that's kind of me in a nutshell.
So what area do you live in?
I'm in Toronto, Canada.
Oh,
Uh,
okay.
yeah, so I've lived here for most of my life. So Toronto is home.
Very
It's,
good.
have you ever been here?
I have not been there. No. But when you were saying the ravines, and so we lived out west for a long time, and there's a lot of ravines out there.
Mm-hmm.
And so I love to go down in the ravines. Now, lots of times we would take four-wheelers and go ride down in the ravines.
Mm. Yeah, I don't think they'd allow that here because
Yeah, probably
they're
not.
kind of fragile environment. So,
Right.
and the trails are dirt trails, and there's a lot of people and dogs on them. So,
Very good.
but I
That
can
does
see how
sound
that would
fun.
be a lot of fun if you're in the right area.
Yes. Okay,
Hmm.
well, let's go ahead and get started with your presentation.
Okay, so maybe if we could put the slides up
Sure.
and move to the first. I think we've kind of done the first two slides, so we can get right to the third one, which is a diagram showing the five pillars that I've included in my business that are useful for creating a balanced lifestyle.
Let me. It's not letting me present.
There we are. That one with the blue diagram, that's the one.
Right, but I want to present it. I don't want to share it.
Okay.
I want to get to a presenter view, so let me go back. Here's my presentation. I had the wrong one. Okay.
Oh, there we are. So if we scroll through the first two slides and go to that blue diagram. There we are. Okay, so in my business, I've set out five pillars for creating a balanced lifestyle. And these include things such as mindset, which involves practices to foster self-awareness, gratitude, resilience, to empower us to navigate life with clarity and confidence. Also, energy healing. I don't know if anybody's ever done any energy healing practices, but it really promotes balance and harmony within the body using the energy meridians. And it's very helpful body, mind, and spirit. Another pillar, which is huge, is sleep hygiene. It's creating a nighttime routine to enhance the quality and restorative power of sleep. Then healthy movement. So physical activity really supports the body's strength, flexibility, and vitality. And leading a sedentary lifestyle, it's very unhealthy and it can actually shorten your lifespan. So healthy movement is really important. And the best way to do that, to create a routine that's sustainable, is to do things you enjoy. Self-care is also a big one, and that's all about making space to recharge, nurture our needs, and honor our well-being. And then if we go on to the next slide, we'll start with pillar one, which is mindfulness and meditation. So mindfulness is about understanding yourself and being present in the moment. Meditation, often seen as a path to self-awareness and compassion, also offers significant health benefits. Practiced for thousands of years, it's now widely used to manage stress and cultivate calm in our fast-paced world. Meditation encompasses techniques that enhance attention, emotional awareness, kindness, which is important, compassion for ourselves and others, and mental calmness, even during difficult situations. Regular practice can foster self-compassion, improve relationships, and help you respond thoughtfully rather than reacting impulsively. Research shows that regular meditation can alleviate stress and improve symptoms of stress-related conditions such as IBS, post-traumatic stress disorder, and fibromyalgia, and many other things. It improves focus and memory. Meditation enhances attention span, boosts mental clarity, and may help reduce age-related memory loss and dementia even.
Ooh, that's good to know.
Yeah, it's you're training your brain, and dementia is all about losing parts of your brain. So the more
Right.
you train it in positive ways, the more resilient it is.
All right. And I
And
lost my mom to dementia, so that's very interesting to me.
yeah, actually, I've been doing a little bit of research into dementia, and it's fascinating. It used to be, oh, you've got dementia, that's too bad. Nothing we can do
Right.
to help you, good luck. Now there are active strategies for dealing with it and even preventing it, which I think is so positive.
Right. And I think that's the way to go is I think for me, I would way rather prevent it than have to find ways to deal with it or work with it in the time,
Yes,
right?
and it's so hard on the whole family.
Do you feel, Bev,
Um,
that that works with all dementias? I don't know enough about dementia now. Mom had Parkinson's induced dementia.
Actually, there are a lot of I've been when I've been researching dementia, I've been coming across Alzheimer's a lot, and same with diabetes. It seems like there's a correlation to all of them. And I mean, there's so much more research to be done, but yeah, there are a lot of coping strategies for Parkinson's as well.
Very cool.
Another aspect that meditation can benefit is better sleep. So regular practice can actually shorten the time it takes to fall asleep and improve sleep quality. Um, Pain management is another one. Meditation aids in emotional regulation and combined with medical care may ease chronic pain. John Kabat-Zinn's mindfulness-based stress reduction program, often referred to as MBSR, demonstrated that mindfulness practices provide relief for those experiencing chronic pain. I've actually taken his 8-week course, and I'm trained to be a facilitator, and it's really fascinating. It seems like a simple practice, but often simple practices can be the most profound.
Okay.
Um, it can also lower blood pressure. Meditation can reduce blood pressure over time and eases strain on the heart and lowers the risk of heart disease, which is pretty significant. It's also known to reduce anxiety and depression. Meditation helps manage anxiety and may alleviate symptoms of social anxiety, phobias, obsessive compulsive behaviors, and depression. And of course, is not a one and done kind of practice. It's all about developing a regular practice that helps us sustain our health. Um, Self-awareness and emotional regulation is also another benefit. Meditation promotes self-understanding and it fosters positive feelings and compassionate actions towards others. It can also help shift our perspectives. So, I think we're hardwired to see the negative in things. And meditation, among other techniques, such as gratitude, can help you see the positive and sort of reframe it in your mind, and over time can shift your mindset. So there are many meditation techniques ranging from simple to more advanced. Starting with a basic practice can help you integrate meditation into your daily routine. Even a few minutes a day can make a difference. So one easy way to get into it is to start off by finding a quiet space. So you sit comfortably in a calm, quiet place with your eyes closed, or gently gazing downward. Some people don't feel comfortable closing their eyes, so you don't have to if it doesn't feel comfortable to you. And then you set a time limit. If you're just starting out, 5 minutes is great. If you can do 10 minutes, that's wonderful too. And what I do is I set the timer on my phone so I know when my time is up. So depending on how much time I have, if I've got 10 minutes, that's usually the minimum I'll do. I'll set it for 10 minutes. If I've got longer, I might do 15 or 20 minutes. And then when my timer goes off, I know that my time is up. And then you just gently bring your attention back to where
What
you're
amount
at.
of time, Bev, what amount of time do you feel is the optimal time for you? And I'm sure it's different for everybody, but for you, like if you could pick, if you had all day, how much
Mhm.
time would you choose?
I would choose 20 minutes. Yeah, for me personally, if I had the time. And sometimes when I my timer goes off, I think, oh no, it's over. And
Right.
did that
And to put
happen?
this, yeah, and to put this into context, 20 minutes, and that's not feeling rushed at all. That's being able to complete exactly what you want.
Yeah, it's knowing that I don't have to rush out the door. I don't have an appointment to get
Right.
to.
And then
Um,
how long have you been doing this? So like if
I
I were to start today, what
mhm.
point should I expect that I could get to a point where I'm comfortable at 20 minutes?
Oh, I think you could do it in a matter of a couple of months.
Okay.
When I first was introduced to meditation when I was in high school, and it was during summer break, and there was a teacher who taught yoga and meditation, and then I actually was more into the yoga, and the meditation was just kind of, just we didn't really even get into it. Just made me aware that it was a practice. And then when I was in university, I started delving a little more into it.
Mhm.
But it so but I there'd be long breaks in between until I finally reached a point where I realized that you can actually have a daily meditation practice. So it was for me, it was a long time, but that's because I didn't have a guide. I was just kind of, picking it up on my own. But
Right.
anyway, so when you start, you select your time, you set your timer, and then you take a moment to check in and see how your body feels. So maybe you're having a great day and you feel all loose and wonderful. Other days you might feel stressed. So you might notice, oh, I've got tension in my neck or my shoulders or my back or wherever. So you just are observing. You're not you know, um, no judgment or anything. And just notice any areas that you might feel stress or tension. And then you start to focus on your breath. So you pay attention to your breathing, noticing the sensation of air moving through your nose, down into your body, and then out of your nose again. And you also might notice the rise and fall of your torso, which is a side effect of breathing. Um, everybody everybody, when they start meditating, they think, oh, I'm not doing this right because my mind keeps wandering. I can't stay focused on my breath. But that is just part of meditation. So when you become aware that your mind has wandered, as it will, gently let go of the thought and redirect your focus back to your breath without judgment. And that's the important part, is not to judge yourself and say, oh, I'm so bad at this. You just view the thought as if it were a cloud floating by, and you just let it drift away, and then you return your attention back to your breath. So it's very gentle. And then when your time is up, bring your awareness back to your surroundings and notice how you feel. Some people like to maybe wiggle their fingers or their toes or, stretch or whatever. Um, and once again, you notice how you feel. So you checked in with your body at the beginning of the meditation. So then at the end, you check in again. Um, at the core, mindfulness is the practice of paying attention to the present moment without judgment. And key characteristics include being fully present in the moment. And many of us are not. We're
Right.
constantly multitasking and, we've got multiple
Right.
things going on. And you let go of the past and future worries, and you just think about where you are right now in the moment. And it's important to cultivate non-judgmental awareness and maintaining emotional balance and responding thoughtfully instead of reacting impulsively. That's a big one. You know how you might be driving down the road and somebody cuts you off, and you can go two ways. You can get all upset
Right.
and,
Right.
swearing and yelling or whatever, giving him a gesture. And or you could just say, well, isn't that interesting? Look at the emotions that came up when he did that. So you
Oh,
can
and
either,
one thing I like to do, and I've tried to do with my kids, is to say, I wonder where they're going. I wonder where they're in a hurry to. What do you like? Did you get a look at that guy? Did you see what he looks like? Does he look like he's going to work? Or maybe it's time that he's hurrying home to his family, or just takes off the anxiety a little bit.
yeah. And the other thing is we don't know what happened to him this
Right.
morning. Like, maybe his dog is ill and he's worried about that. Maybe his wife is ill, or maybe he has some real work pressures and he's rushing and he's not thinking, he's not aware of his surroundings. He's just going, going, going. So there's a little bit of kindness there too, in
Yes,
appreciating that we don't know what's going on with him, and we can't manage what he's doing. We can only manage how we respond to what he does. Um,
exactly.
and another real um, uh, characteristic of mindfulness is strengthening your connection to your authentic self. So sometimes we get caught up in people pleasing or wanting to present ourselves in a way that we think will be acceptable. Whereas when you become mindful and you meditate, you start to get a real appreciation for your authentic self, who you really are, and how you want to show up in the world. Mindfulness can be integrated into daily activities. For instance, walking meditation involves paying attention to each step, noticing how your heel touches the ground and the motion in your foot as it rolls through the step. Next time you take a walk, you can try focusing on each step when you're not in a hurry
Right.
as a way to bring mindfulness to the experience. And it's kind of it slows you down, and you just really focus on one step and then the next step, and it's that is actually a mindful activity. Um, I was first introduced to mindfulness through an MBSR 8-week program developed by John Kabat-Zinn. This approach blends yoga, meditation, and present moment awareness, and it emphasizes mindful responses rather than automatic responses or reactions. When I began meditating in university, I thought I was a bad meditator because my mind constantly wandered. And so it's very important to learn that the practice itself lies in gently returning your focus to your breath every time your mind drifts. And with regular practice, meditation becomes easier and more intuitive. So that 8-week program actually is a wonderful start for anybody who wants to establish a daily meditation practice.
And what was that again?
John, Jon, Cabot, Kabat hyphen Zinn, Zinn. And he was a professor at a medical center. I believe it was in Boston. And he's retired now, but he still holds the title as an honor as a professor. And when he had his mindfulness and meditation practice in the hospital, actually other doctors started noticing the change in the people that came to his practice, and they started sending their patients who had who were dealing with pain for the most part. And it's like, okay, I've done everything I can with you. There's nothing more I can do as far as medicine goes to help you. Go to this workshop, and it would have profound results. Um, So to build a meditation practice, you just simply set aside time each day. It's nice if you can do it consistently, but we don't all have lives that, run like
Right.
clockwork. So it's just, whatever time works during the day. And as you grow comfortable with the process, you can explore different meditation styles because there are many to help deepen your practice and cultivating lasting well-being. And now we're going to move on to the next slide, which is about energy healing. So, energy healing is a complementary practice rooted in ancient traditions like traditional Chinese medicine, commonly referred to as TCM, and Ayurveda. It works by balancing the body's energy flow to promote physical and emotional well-being. Techniques vary, but the aim is to clear energy blockages. Traditional Chinese medicine focuses on qi, the body's vital energy, and imbalances in chi can lead to illness, is what they believe. Ayurveda is an ancient Indian system, and it centers on prana, which is a life force. It emphasizes restoring balance to maintain health. And there are many energy healing practices, and you may have experienced some, or you're probably familiar with some, but Reiki, emotional freedom technique tapping, referred to as EFT tapping, acupuncture. We've all heard of acupuncture, and I think that's probably one of the more mainstream energy healing practices. There's crystal healing, sound healing, which is wonderful. If you ever get a chance to go to a sound healing session or a sound bath, I would highly recommend it. Qigong, which is a Chinese sort of like a cross between martial arts and yoga. Reflexology, many people have had reflexology treatments, chakra balancing, and even shamanic healing. And there's many more techniques. I've personally practiced Reiki for 17 years, offering sessions to cancer patients and caregivers at a local hospital, among other things. I worked in a private clinic at one point and so forth. Initially, I was quite a skeptic. I realized but when I had my first treatment, I realized quickly the profound effects of a Reiki treatment. It's really amazing. And in my practice, I noticed as well. Um, People would come in all stressed out and anxious. And by the end of the treatment, they were so relaxed. It would take time to ease them up off the massage table. And then it was like they floated out.
Oh,
It was very rewarding as well. And it just, it feels good receiving it. It also feels really good giving it. Um, So Reiki involves channeling energy through the practitioner's hands, either with or without touch, to balance the client's energy. And this can promote relaxation, reduce stress, and improve overall well-being. EFT tapping, or emotional freedom technique, is the other one that I'm more familiar with as a practitioner rather than just a recipient. And I discovered EFT tapping about 6 years ago, and I was fascinated by the ability to address emotional issues effectively. Tapping has shown success in treating PTSD, particularly among veterans, by offering a non-invasive alternative to traditional talk therapy. Talk therapy can sometimes re-traumatize people, but tapping really doesn't do that because you don't have to relive the experience. You just identify what you want to work on, and then you just work on it. But common uses for ETF tapping are anxiety, depression, PTSD, and food cravings, and pretty much anything else that you want to work on. And the process is you identify the issue and only focus on one issue at a time, and then you test the intensity. So you say to yourself, well, how difficult is this for me? And you rank it from 0 to 10, with 10 being the highest and 0 being it's not affecting me. And then you find a phrase that acknowledges the issue while tapping on the karate chop point, which is right here, and on the side of the hand. And it might be, even though I have anxiety around social situations, I deeply and completely accept myself. And the tapping sequence which you do while you're repeating the phrase. It's top of the head, beginning of the eyebrows, side of the eyes, under the nose, chin, and then your collarbones, and then under the arms.
I've never heard of that. That's so interesting.
Have you never Google it? It is really
Yeah, I will
fascinating.
Google it, but this is just so interesting.
Yeah, when I first heard about it, I was in my car driving from one appointment to the next, and I had a radio on, it's like a talk radio station they had. It's really interesting topics they come up with, and they started talking about this and how it really is so helpful for veterans. In fact, it's the only thing that is really proven to be effective in helping them let go of the trauma and get back into mainstream life. And my dad was a veteran and he had post-traumatic stress disorder. So that really caught my attention. And I think that was what initially, that was the hook that got me. And then I discovered that it can help so many people in so many different ways in life. After
Yes.
tapping, you reassess the intensity again. And so if you started off, say, at an 8, you might find it's gone down to a 6. And so you just repeat the process a few times. And and then maybe you won't get down to 0 the first time, but if you tap on it, say you set aside 15 minutes every day to do some tapping on an issue that's bothering you, you might find that you get down to 0 fairly quickly.
Do you find that completely resolves the issue, or you have to keep revisiting it? Or it just
Um,
depends.
it usually is very helpful. If it does come up again, you just simply tap on it again. So yeah, I mean, everybody's different. So for some people, the first time they might completely resolve it and it never comes back. For others, and it also depends on what they're tapping on, what they're trying to resolve.
Right.
They might have to tap on it a number of times and they may get very low, like to a 1 or 2, but maybe they never actually get to 0. So it really depends on the person and the experiences they've had.
And
But
so
if
you said this is less traumatic, obviously, than talk therapy.
well, and I think once again, it's an individual thing, but with talk
Mhm.
therapy, very often you have to relive the trauma. Whereas this,
Right.
it's like you already know what the trauma is, you just identify it and you tap on it, and it's on the meridian points, the energy points, and it just releases without traumatizing you. So, energy healing, including Reiki and EFT tapping, offers effective complementary approaches to physical and emotional health. Research suggests that these methods promote relaxation, reduce anxiety, and improve overall well-being, empowering individuals to restore balance in body and mind. And now we're going to move on to the next pillar, which is sleep hygiene, which is one that I think pretty much everybody can relate to on some level. If sleep feels elusive to you, you're not alone. Many women, especially perimenopause women, and especially during perimenopause and menopause, struggle with restless nights. Poor sleep affects mood, focus, metabolism, and the body's ability to combat inflammation, which is kind of fascinating. When you're sleeping is when you heal. Sleep hygiene refers to your sleep environment and behaviors. Poor sleep hygiene can impact both the quality and the quantity of sleep. Good sleep hygiene includes maintaining a consistent sleep schedule, following a bedtime routine, forming healthy habits, and optimizing your sleep environment. Healthy sleep supports physical and mental health, and it embraces productivity and improves the overall quality of life. We all know what we feel like if we don't get a good night's sleep.
Right.
Yeah, so good habits become automatic over time and reinforce the positive behaviors. By optimizing your environment and routines, you can set the stage for better sleep and long-term wellness. Signs of poor sleep hygiene are difficulty falling asleep, frequent sleep disturbances, daytime sleepiness, and inconsistent sleep patterns. And there are a number of steps we can take to improve sleep hygiene. So, first of all, we want to optimize our sleep schedule. So, set a fixed wake up time and wake up at the same time daily, even on weekends, to establish a consistent rhythm. And prioritize sleep. Treat sleep as an essential. Set a target bedtime based on your wake up time and try to stick to it. Make gradual adjustments. Shift sleep time slowly to avoid disrupting your internal clock. And then limit naps. So if you feel you need a nap in the afternoon, try and limit it to 20 or 30 minutes. And, if you don't need one, then don't take one. Also, follow a nightly routine. Be consistent. Perform the same steps each night. So we all put our pajamas on and brush our teeth, and that starts to signal that it's bedtime. But we start even before that. So it's a good idea to wind down for 30 minutes and engage in calming activities like reading, stretching, or meditation. Dimming the lights is helpful. So if we lower lighting to encourage melatonin production, that is helpful. And unplug from electronics. I know this is the hardest
Yeah.
one for me, and I'm sure it is for many other people, but we want to avoid screens 30 to 60 minutes before bed to reduce stimulation and blue light exposure. And then relax, don't force sleep. If you can't sleep, if you go to bed and you find you're just tossing and turning, and after about 20 minutes you can't sleep and you're feeling, wide awake, then just get up for 20 minutes and do something relaxing in a low light. So, keep the other things, the low lights, and unplug from electronics. Maybe you're going to read or meditate or whatever. And then we want to also cultivate healthy daily habits. So one important thing is getting daylight exposure. Sunlight regulates our circadian rhythm and also supports better sleep. Exercise is really good. Physical activity promotes deeper sleep and limits stimulants. So avoid nicotine, reduce caffeine intake in the afternoon and the evening. Also, alcohol. We want to moderate our alcohol consumption. Alcohol actually disrupts sleep cycles, and it disrupts our whole, when we get to bed, even if you get to sleep, you might wake up again as a result of
Right. And
alcohol,
I find
especially.
that really the sunshine and the exercise is huge, balancing
Mhm.
mentally, but also the vitamins that you get from the sunshine are so
Yeah,
essential to mental clarity.
absolutely. We also want to eat earlier in the evening. So, and avoid heavy or spicy meals late at night to prevent digestive disruptions. Um, and another thing is just to use your bed for sleep. So reserve your bed for sleep and intimacy only to strengthen the sleep association.
Ah, that's a good one because so many people watch TV in bed, right?
Hmm.
Or they game in bed, or they read in bed.
Yeah,
I
or
do. I am guilty of saying my morning prayers. I always start them in bed because I find that if I don't, then I forget, so as soon as
yeah.
I wake up, I do. But
Hmm.
yeah,
And
I've
you know what?
never been one, I never watched TV in bed.
Yeah. And some people even bring their laptops and their phones to bed with
Oh
them.
yeah, huh?
Don't want to do
I,
that.
I didn't think of that. I do check the weather right before I go to bed. Um, in Missouri, it just changes so quickly.
Hmm.
And so I do check the weather right before I go to bed to make sure we're not expecting storms in the night.
Yeah. I've got Alexa, so I ask Alexa every morning when I wake up, what's the weather like today?
Oh, good. Yeah, we don't have.
Um, yeah, so the next point is to optimize your sleep environment. And that would be things like a comfortable mattress and pillow.
And
And
I
these,
think that's hard right now
mhm.
with the time change and the
Yes.
temperature change. I was telling my husband that this morning that I'm not getting a good night's sleep because I can't optimize the temperature in our home right now because
Hmm.
it's Missouri's weird. Like we can be 20 degrees and then within 12 hours it's 75.
Yes.
And
Yeah.
so it's hard at
Yeah.
night to get the temperature of our room correct to
Yeah.
stay steady.
Yeah. And so it's better to have a cool room and to aim for a cool, comfortable space around 65 degrees Fahrenheit. Not always possible, depending on where you live.
Right.
And then another thing is quality bedding. So soft, breathable sheets really enhance our comfort levels once we get
Yes.
into bed. And then light, block the light out. Use blackout curtains or an eye mask to keep your room dark. I know I use an eye mask frequently. If I'm finding I'm having a difficult time getting to sleep, I'll start off with it on top of my head, and then when I can feel myself dozing off, I pull it down over my eyes. Another thing is noise. So you want to reduce the noise, and that might be things like using earplugs, a fan, or a white noise machine to mask any disruptive sounds. And then
Yeah,
some people like calming scents. So light scents
I
like
do.
lavender can promote relaxation. It just depends. Not everybody likes lavender, but there might be something that you like that feels restful and peaceful to you. But the key is to personalize your approach. So effective sleep hygiene varies for each person. And you can experiment with some small adjustments to discover what works best for you personally. While improving sleep hygiene can enhance sleep quality, chronic sleep problems may require medical intervention. So if, like sleep apnea and that type of thing, if
Right,
you have those kind of issues, make sure you consult a healthcare professional and get your treatment tailored to fit you specifically.
sure.
And now we're going to move on to pillar 4, which is healthy movement. And there is an overwhelming amount of evidence that recognizes physical activity as a key component of a healthy lifestyle. Being physically active can improve health outcomes in all individuals, regardless of age, gender, ethnicity, or disability. For this reason, consistent physical activity is an effective lifestyle intervention for optimizing overall health and well-being. There are many benefits to physical activity and your health. These include a decreased risk of chronic conditions such as heart disease, stroke, hypertension, and type 2 diabetes, as well as cancer. Physical activity has also been shown to affect brain function by reducing the risk of Alzheimer's disease, as well as improving anxiety, depression, sleep, cognitive function, and overall quality of life. Um, Strategies to improve physical activity include moving more and sitting less during the day. Any physical activity is better than none. So you don't have to have a vigorous workout routine. Um,
Right.
you can just, go out in the morning and go for a 30-minute walk. I have one doctor who said you should walk for about 60 minutes every day and get your heart rate up. Adults who sit less and engage in any who sit less and engage in any amount of moderate to vigorous physical activity experience benefits. It's also very good for your brain. Muscle strengthening activities should involve all major muscle groups, and you should do these 2 or more days a week. Balance training is also a big one. And if you can incorporate balance training into regular exercise routines, it's particularly beneficial for older adults. But
And
I,
what is balance training? What exercises would fall under that?
well, if you do yoga at all, there are a number of balancing exercises like, tree, all sorts of them. Um, Sometimes just standing and practice balancing on one foot and then switching and doing it on another. So there are a number of different practices, but I find yoga exercises are really, really good. Um, and it's really beneficial for older adults. So if you start doing balancing exercises when you're a younger adult or, a middle-aged adult or whatever, it's really setting the stage for when you're older because you think of all the people that fall and really injure themselves. People can, break their hips or their pelvis or whatever.
Right,
So being being able to maintain your balance throughout your life is a really good skill, a really helpful
right.
thing.
So I have a close friend that is in her 70s and she teaches chair yoga, which I think is just phenomenal because there's so many people who are mid-age or older who feel like they're too old to start yoga or too
Yeah.
off balance to start yoga. But chair
Hmm.
yoga is such a viable option. They're even teaching it in nursing homes. And it does
Yeah,
help with balance and it starts smaller and you have your foundation already so you're not so wobbly.
that is so true. And chair yoga, you can even do, you can get up out of the chair and put your hand on the back of the chair just to
Yes.
make yourself feel more secure and do your balancing poses there. Um, it's just really, really important, especially as we age. Um, Another thing is we should get more than 300 minutes of moderate intensity aerobic physical activity a week. And that gives you many more physical additional health benefits. It could be walking, running, you could be indoors, you could be outdoors,
Swimming.
swimming, anything that gets your heart rate up. And this aerobic activity, you shouldn't go out and do your whole, 300 minutes in one day. You want to spread
Right.
it out over the week. Regular physical activity is really essential for maintaining health and longevity. So aim to engage in a variety of exercises that includes aerobic activities, muscle strengthening workouts, and balance training each week. And tailor your exercise routine to fit your preferences. Not everybody loves yoga, not everybody loves Tai Chi. That's a good balancing one too. Um,
And
so
I love riding my bike.
yeah, so that's an amazing way to get your aerobic activity in. So you just tailor your exercise routine to fit your personal preferences and lifestyle, and then it becomes much easier to maintain the activity. Um, Consistent movement throughout the day can significantly improve your overall well-being. So try things like occasionally taking the stairs instead of the elevators all the time, and park further from your destination to get in some extra steps. So I started doing this. I started doing this a while ago when we all got very conscious of how many steps we were taking every day. So when I go to the grocery store, I always used to hunt for what I would refer to as executive parking, like something right close to the
Right.
door I can zip in and zip out.
Prime parking.
Yeah. And then I realized, you know what? This is not beneficial because first of all, I shouldn't be that rushed. So I should be able to slow myself down that I don't feel the need to zip in and zip out. And then, if I park back towards the back of the parking lot, I get more steps in on
Right.
in
And you
in
know what else? I used to get so frustrated, I would create my shopping list by the direction of the store. So I'd
Mhm.
start at one end and shop my way through the store. And then if I got to the end and realized I forgot something and had to go back, I would get so frustrated. And now I just don't. Now I'm like, it's just a little bit of time and it's so many more steps, so much better for me. So I just
Yeah.
don't even do that anymore. I literally specifically go from one end to the other and back so that I do get a few extra steps.
Yeah. And there are, many ways we can incorporate that type of behavior into our lifestyle. And sometimes to make it easier to exercise, um, whether it's walking, running, or going to a fitness class, go with friends. So if you're going
Yes.
for a walk in a ravine or a park or whatever, or even just on the street, bring a friend along. Um,
Especially one that talks,
yes,
because I absolutely lose track of time if we're talking.
yeah.
We just walk and talk.
Actually, when you walk and talk, you're using two different skills, also very good for the brain. So you're getting some social time in.
Mhm.
You're walking and talking, so you're kind of coordinating those two actions, and that it helps you maintain a fit brain in a very easy way. Um,
Yes.
yeah, and then the next slide is pillar 5. So this is our last one and it's all about self-care. So, as women, many of us were brought up to believe that we had to take care of everybody first, make sure everything is working right, and then we have time for ourselves. That is not healthy. That
It's
is
so backwards, isn't it?
Yes, but I don't know. I was certainly brought up not to be selfish and
Right.
to be very, aware of other people's needs. And when you think about it, why are other people's needs more important than your own? And they're very, usually, especially men, are very good at taking care of their own needs and asking for what they need, whereas women are more likely to take care of everyone and then focus on themselves.
Yes.
And
And we don't ask, I think, because we don't want to be a burden and because we are very much aware of what everybody else has going on in their lives, where I think other people are less aware of what you're carrying and what's going on in your life. And so they don't think twice about asking for help.
I think that is so true. Um, and it's not healthy.
Right.
And everyone has a different idea of what self-care is. So it might be a
Right.
relaxed bath, a walk in nature, might be applying a face mask or relaxing in front of the TV. While these can be relaxing, self-care goes well beyond occasional treats. It involves intentional practices that support your physical, mental, and emotional well-being. True self-care requires thoughtful attention to what generally benefits your health and helps you thrive. So, self-care involves taking steps to maintain and improve your well-being. Um, do things that support both mental and physical health. Even small self-care actions can significantly enhance your overall quality of life. Self-care is about being responsible for your own well-being rather than being responsible for everyone else's well-being. With kids, it's different, but you want to also set a good example for them and let them know that yes, you're there to help them, but you also are taking good care of yourself.
Yes, and it took me until I had grandkids to be able to say, look, I cannot do that right now. There's too much going on in my mind. I need a few minutes for me to think, and then I'm happy to come back and help you with that.
Yeah, and that is very important. So prioritizing self-care helps you manage stress. You reduce the risk of illness and you maintain energy levels. And you probably notice when you do speak up and set a boundary like that, it manages your stress. So you're
Yes.
not stressed out thinking, "Oh, I've got to do this, I've got to do
Well,
that."
yes, and everybody's on the same page, then they know what I need and
Mm-hmm.
they know that they're still important and it's coming up.
Mm-hmm. Absolutely. Self-care is really important. So neglecting your self-care can lead to physical and mental health issues like burnout, anxiety, or chronic conditions. We all should be proactive about our health needs. And I think we need to bring it to top of mind awareness so that we don't forget to take care of ourselves. Um, so it helps us prevent burnout, it maintains emotional balance, and it allows us to process stress more effectively. Regular self-care practices can enhance overall happiness and energy. If you're not running around worrying about everybody else, you've got more energy to expend on the really important things.
Right.
Self-care yeah, it encompasses physical, mental, emotional, social, and spiritual aspects. Physical self-care involves nurturing your body through sleep, exercise, and proper nutrition. Proper nutrition is important because it provides the fuel to get us through our busy days and keep us strong and healthy. Mental self-care is something that we maybe don't think about a lot, but it supports psychological well-being, and it can include activities like mindfulness, meditation, and engaging in hobbies. Maintaining mental health positively influences how you think, feel, and handle stress. Emotional self-care is another one. And emotional self-care means recognizing and managing your feelings. This can involve journaling, talking to loved ones, or setting healthy boundaries, as in your example,
Right.
calling. It is important to develop coping skills surrounding emotions like anxiety, sadness, and anger. And we all experience those emotions from time to time. They're very normal human emotions, but how we respond or manage them is what is important.
Right.
Social connections are also essential for well-being, and maintaining close relationships can provide vital emotional support. Ideas for social self-care can include watching a movie with friends, calling a loved one and having a conversation, sharing a meal with someone special, or scheduling family get-togethers. So it's maintaining that connection with the other people in your life that really is significant. And loneliness is almost an epidemic now, and it got worse over the pandemic. So we need to think about, our social self-care as well. Spiritual self-care is another one. So spiritual self-care fosters a deeper sense of purpose and can include activities like meditation, yoga, time in nature, or religious practices. For some, it involves prayer or engaging with a spiritual community. It just, everybody, once again, is different, and you just find what works for you and engage in that. So, self-care is about meeting your needs responsibly while maintaining a balance with others' needs. And optimizing your health allows you to stay energized and productive, allowing you to be a contributing member in your community and in your family. So then the big question is, well, how do I start a self-care routine? So first of all, we're acknowledging that as in all things in life, we're all different. We all have different needs. So assess your needs. Identify areas where you may feel depleted, whether physical, emotional, or social. And do you have health concerns like anxiety or burnout? And then set small, achievable goals. So focus on one area to improve and develop manageable habits. For example, if you want to increase your exercise, start with a simple routine and build on it. And incorporate joy. List activities that bring you joy, such as walking, music, or spending time with loved ones. And try to incorporate these activities into your daily routine. So, whatever it is for you that brings you joy, try and incorporate it mindfully and incorporate it
Right,
into your life rather than just notice it. Oh, this was fun. This made me experience.
right.
You
Purposely
actually, yeah, you
included.
seek it out and find support. So surround yourself with people who encourage your self-care efforts. Perhaps find a group of people who walk together or a yoga class you enjoy. Sharing your goals with others can also help you stay accountable. So if you and your friends know that, every Friday you're going to your yoga class and then you don't show up one day, they'll wonder, oh, well, what happened to Colleen? Why isn't
Yeah,
she here? So, I find that if I make an appointment to meet people, I'm more likely to do it than if I just have an appointment with myself to do something. So it does keep you
right.
accountable.
Well, and I think if we would learn to treat our appointments with ourselves like we would our loved one's doctor appointment,
Hmm.
we would make sure that it happens.
Yeah,
Because
and
we cancel those, we don't cancel when it comes to
totally.
somebody else.
So if you foster a sense of self-worth, then I think you're more likely to keep those appointments with yourself too.
Right,
The other thing is to be flexible. So as your approach or your so adjust your approach as your needs evolve. It's normal to have setbacks. So maybe you go a whole week and realize, oh, I didn't get out once today or this week. I didn't get out and exercise. I didn't get to the gym. So, just recognize that it's normal to have setbacks and allow yourself grace and revisit your self-care strategy when it's necessary. So it's maybe you didn't get to the gym all week or you didn't, do whatever
right,
it was that you had planned. So ask yourself, well, why didn't I? And then, kind of figure out what got in the way. And then maybe if you need to adjust your routine, adjust your routine at that point. By prioritizing self-care, you cultivate resilience, you improve your quality of life, and you sustain the energy needed to support yourself and others effectively. So, in summary, a balanced lifestyle encompassing physical, mental, and social well-being helps reduce stress, improves mental health, and enhances productivity. It strengthens relationships, and ultimately, it leads to a happier, healthier life. And, for all we know, we're only on this planet once, so we want to make the best of our lives. And we've only got one body while we're here, so we want to take the best care we can of our body. A healthy lifestyle cannot only help you feel better, but it can also reduce the risk of some diseases and lengthen your lifestyle. The key to success is to start small when you make changes and then it's easier to incorporate one healthy change into your lifestyle and then build on that success. And that pretty much brings me to the end of what I had planned to talk about. Are
well,
there
I
any
think that
questions?
this is so important, and I'm so grateful that we're in an era where we're actually teaching women to do this. And at the same time, I feel a little bit sad that we have to teach women this, but
Yeah.
I was raised in the 70s and we were really taught differently.
Totally. Like
And so,
myself, I don't have a daughter, I have a son, but if I had a daughter, I would have instilled very different things in
excuse me.
her than what were instilled in me. So instead of saying, well, you can't be selfish, you have to make sure everybody is taken care of, I would say, take care of yourself first, and then you've got the energy to take
Yeah,
care
then
of
you can take better
others.
care of other people. But
Yeah.
having to tell ourselves that we need to um, feel worthwhile. You know, the first time that I wrote down, I am worthwhile, I felt um, not worthwhile. I felt
Hmm.
like that was weird. I felt like I shouldn't even think about that, right?
Hmm.
And we were kind of
Yeah,
raised that
because
way, that we're to be seen and not heard, and we're
yeah.
to be on the back
Hmm.
end holding things together in the privacy of life. Never
Hmm.
thought to put ourselves forward or to value taking care of ourselves first. And
Yes.
so,
Yeah.
but what better people we are when we do that.
Totally. And the other thing is, I think we were brought up not to share if something made us angry or if something wasn't right, just to sort of resolve it and not burden anybody else with it.
Yes,
Whereas now we know that it's so important, to
right.
talk about what's going on and help have people that may be able to help you find solutions.
Yes. And I think especially in the big things, you know, the big tragedies or traumas in life, whether you've lost a loved one or a child or a marriage or things like that, you know, we're taught that I was raised that private things are private and you just don't speak about them. And then
Yes,
also that we're there to help our husbands through these things.
be a
And certainly
helpmate.
they may know a little bit about what we're going through, but I was never taught to say to them, no, look, this is actually where I am and how I feel, and this is the help I need, and this is how you can best support me. But
Hmm.
I think it helps us to be healthier, to live
Hmm.
longer, to be mentally founded, grounded better when we do share those things, you know.
Absolutely. Hmm.
Well, I appreciate your time today, Bev. This was amazing, eye opener. I loved it.
Oh, thank
And
you. And I love being here. So thank you so much
yes,
for having me.
very good. And I will post a the replay.
Okay, wonderful. Yeah.
Okay, let's see.